I chose pain management because it allows me the opportunity to really make a difference in patients' lives. I feel like as a person or as someone who helps patients with pain, oftentimes they tell me it not only affects themselves, but their family, their friends, their kids, their significant others, their neighbors. So part of why I chose pain management, it allows me to really get patients back to the lifestyle that they want to achieve.
I enjoy seeing patients and see them for a prolonged period of time. So I developed personal relationships with my patients and with their families, and a lot of times I end up seeing not only the patient but also members of the extended family, and that brings up quite a bit of satisfaction for me.
The reason I chose pain management as my career was the fact that I wanted the patients who have been suffering most of their lives and have not been able to participate in their activities of daily living and are socially isolated. I wanted them to not only improve their activities of daily living, but go beyond it. They should be able to thrive and do much better.
I had severe right knee pain and swelling that arose after a hockey injury where I tore my PCL as well as my medial meniscus. Like I said, I couldn't walk for more than 20 feet at a time. Navigating stairs was very challenging.
Before I came to the pain center, I had 3 back surgeries. I was fine for 6 years, and then the stenosis came in, and the doctors said there's really not too much they can do for me.
I was unable to do things like walk upstairs. I was unable to get in and out of a car easily. I was unable to lift my knee. It unfortunately really was a very negative influence on my life.
It was not good because I had trouble walking through airports. I mean, there was times I would have to take a scooter to go through when I was on a vacation, and since then I don't have to do that. I have no problems walking through airports. I might go slower, but I can do it now on my own, so I'm very happy.
I would never have thought of going to a pain doctor. A friend of mine has been going to him for, I think, 4 or 5 years, and she had trouble with her neck, and he did wonders for it. I brought her all the time, and then I got so tired of it. My knee hurting. I thought, well, I'll try it. And it worked.
In our specialty, there is certain risk of medications which can cause some dependency. So that is why we try to use what we call as multimodal receptor theory, that we try medications of various kinds to help them decrease their pain by different mechanisms of actions.
We have a very welcoming atmosphere. We treat our patients as part of the family. We are trying to make sure they're comfortable throughout the process, and we are great diagnosticians. We use all the latest available technology in regards to diagnoses, and we also communicate on a very high level with specialists of other medical fields.
In pain management, we treat a wide variety of chronic pain programs, and that's everything from the head, all the way from the head to the toe. So things like headaches, occipital neuralgia, neck pain, back pain, joint pain, muscular type pain, sports-related injuries. So we treat a gamut of pain problems.
She did a cold leaf RFA, which was done beautifully. It was done under MAC anesthesia. So I was talking to the gentleman, asking him when it was going to be done, and the next thing I knew, he said, "It's time for you to go home." And I had wonderful results. It's the only thing that really worked.
I've been able to cross paths with all the doctors, Dr. Hassan, Dr. Bave, as well as Dr. Bucalo. It's been nothing short of excellent. They're very friendly, easygoing. They explain all of the procedures, even the response I was expected to have, which they were very spot on.
Part of being a pain management provider means that I get to speak not only with patients but also with their primary care doctors, their orthopedic and neurosurgeons who have been beneficial in their treatment as well. So the approach that we use at Northwest Suburban Pain Center is a very collaborative approach. So it's not one single person really dictating care, but also it's teamwork that really makes patients have a successful treatment course.